So before I introduce today's speakers, I want to acknowledge the passing of Portland Commissioner Nick Fish. His passing is a great loss to our community, and my thoughts are with his family. I met Nick in 2009 when I moved back to Portland, and he was actually the first person to reach out to me when I became executive director of City Club. And that's what I think most when I think about Nick, is he always would pick up the phone, call you, and tell you what he thought about what you were doing, whether he liked it or he didn't like it. And that's really my personal lasting memory of him. He was really a public servant, I think, through and through. And I read, like probably many of us did, his resignation announcement earlier in the week. And a couple sentences really stood out to me as kind of a call to action to the City Club community. So I just want to share them with you. So he said, "Across the country, the last decade has seen a stark decline in civility. Portland has not been immune to the national weakening of civil discourse. And as we grapple with the future of our country and our planet, we are becoming a big city with our own growing pains. We can rise to this occasion and embrace inclusivity, sustainability, and shared prosperity for all. We must unite around these values and make them real through collective effort." I'd like to ask everyone to join me in a moment of silence to remember and honor Portland Commissioner Nick Fish. Thank you. To turn to today's conversation that I think Nick would very much appreciate, let me introduce today's speakers. So our moderator is Mark Jolin, Director of the Joint Office of Homeless Services. And our speakers include Tremaine Clayton, Head of the Street Response Team at the Portland Fire Bureau, and Kaya Sands, Executive Director of Street Roots News. Today we'll be discussing Portland's Street Response Pilot Program as part of our ongoing series on homelessness. Please help me welcome today's panelists to the stage.
Well, thank you all for having us here today. Again, my name is Mark Jolin. I'm with the Joint Office of Homeless Services for the City of Portland, Multnomah County, and I have the honor of moderating this panel. So I'll be asking questions of Tremaine and Kaya, and I'll just go ahead and start with Tremaine. Tremaine, can you start by just giving us a very brief overview of what Portland Street Response is for anyone who maybe hasn't heard about it?
Yeah, sure. Thank you. Thank you all for having me here, and it's a great opportunity to speak about this project that I've been thinking about personally for some time. The Street Response Program conceptually is a mobile integrated healthcare model type response, and it's a tool to improve our response reliability. The idea behind Portland Street Response is that if there's no fire, no immediate life threat, or no active crime, which are the traditional reasons why you would call 911, calling 911 would get an alternative response to police, fire, and medical for the lower acute calls.
And we'll have an opportunity to dig into a lot more of the details of the program as this conversation continues. But I want to take us back to the history of it. And Kaya, Street Roots was instrumental in starting the conversation about the need for something like Portland Street Response. What prompted Street Roots to research and do a special report on who responds to people experiencing homelessness and behavioral health issues currently? and maybe talk to us a little bit about what your reporting revealed.
Sure, thanks Mark, and thanks everyone for coming out. It's heartening again and again to see how many people care about this issue. So Street Roots, we've been around for 20 years, and for the duration of that time we have always been concerned with how the legal system can entangle people in poverty. And when we look at how sometimes legal responses to economic problems just make the economic problems worse. So I really look back to the Oregonian reporting of the summer of 2018, and how the Oregonian revealed that in 2017, 52% of all the arrests of unhoused people, of people in Portland were unhoused people. And most of those arrests really had to do with really low-level issues. So we looked at that and we really thought about it analytically. How do we take that number that is way too high and that is making life so much harder for people who are houseless, because it gets in the way of housing and it gets in the way of employment, and how do we start to chip away at it? And then there was a subsequent Willamette Week report that some of you might have read, that every 15 minutes 911 fielded a so-called unwanted person call. Every 15 minutes. And on top of that, every 4 minutes 911 was fielding a non-criminal call for the police. So basically we're looking at a system in which we're bogging down our 911 system, and we're sending out the wrong first responders for street crises. So that's really why Street Roots took this on. We have the fortune of being outside enough that we can push and say, I think that system needs to be changed. We work with people who are houseless every day, so over the coffee pot, we hear all of the stories of these legal entanglements and the frustrations that people are experiencing. But then because we run a newspaper and we do advocacy, we can also then say, okay, if that system is leading to these results, how do we actually change the system? Just one final comment, I'll back up even from that and say that I also think that we, in this very moment, have this opportunity to be a national leader, because we really have two forces. We have the Trump administration issued a report this fall in which they were basically saying unhoused people need to be policed more. And we know that that is just making life more difficult for people. So I think we can be a leader in showing how we can actually have a different response in Portland.
All right, and I'll ask this question of both of you. This pilot project is modeled somewhat on a program in Eugene called CAHOOTS. I think both of you have visited it and talked to the folks involved there. I'm interested in what your major takeaways were from that program in particular that you've used to inform how we're thinking about street response locally here in Portland.
Sure, yes. As I said, the street response program is a mobile integrated healthcare program, and that's a fancy community paramedic term that is being used kind of nationally right now, as other departments and other agencies are looking at trying to decrease our call volume the way the system currently is. Right now, a lot of people, and we're using tools that look at social determinants of health to really try to figure out what is the reason for the 911 call. This program, like many others, like in Baltimore, Tulsa, we're looking at the data and we're seeing that of our responses, a lot of them are non-critical calls. That is, like, we'll go there code 3 with lights and sirens, but our return to the hospital, very rarely do we have to rush to the hospital because it isn't that great of an emergency. It's an emergency to the person involved, of course, but in terms of our standard, it's not an acute emergency. And so looking at that data, how can we proactively get to those people, figure out what is the underlying need, and try to connect them to those resources? And so given that concept, I started looking at our program, which is let me back up. The chat program currently exists doing that, looking at the high utilizers, which as we're trying to change stigma, we're really looking at vulnerable populations with unmet needs. They're calling for service, but they're not receiving the service because the current system they're calling doesn't provide those services for that level that they're focusing on. So looking at that model, and then I take my personal experience where I volunteer with Whitebird as a medic, and I do what's called rock medicine, which is like the event medicine. So if there's a concert at the Key Night Arena, Oregon Country Fair, we'll provide medical crisis services, which is more or less a fundraiser for the Whitebird Clinic. CAHOOTS is another service that Whitebird provides, which is that response using a medic crisis worker. So taking all of that information, seeing what the national standards are for other fire departments and how they're trying to address these needs, seeing what CAHOOTS has been doing to address those lower acuity calls, it just started making sense in my head. Why aren't we doing that in Portland? The reporting that took place with Street Roots, yay. I'll just say yay, because it was like that concept actually came to light, it got support, and that's where we're at today. So that's what I would say about it.
Yeah, and so if I back up to, let's see, November of 2018, Street Roots interviewed former police chief Danielle Outlaw, and she talked about how she really wanted to remove the police from the non-criminal matters. So we took that very seriously, and we took it as a kind of challenge to think about, what is it what could this look like? But fortunately, we have a model in Eugene. So, the police chief, Mayor Wheeler, Commissioner Hardesty's staff all traveled down to Eugene. I traveled down to Eugene to ride along with CAHOOTS. Whitebird has been around since the late 1960s in Eugene, and then CAHOOTS since the late 80s. And so they're, it's very institutionalized in the city. The estimate is that CAHOOTS costs a little over $1 million per year in Eugene and saves over $8 million in the police budget by fielding these calls. So you can really see how this is just a change of system. So when I rode along with CAHOOTS, a couple things really struck me. There's a medic and a crisis worker, similar to what we're going to be doing up here. And a couple things struck me. One of them was that because people could show up without a badge and a gun, in their hoodies and their jackets, and they had trust, they were able to really listen. And I learned fairly quickly from the people in the van that they were interested in the story beneath the story. To give you one illustration, we pulled up to a convenience store. A man was having a kind of outburst, so someone had called 911. They fielded it to CAHOOTS. The man had an untended wound, so the medic treated that. He treated the wound, right? That was causing him a lot of pain and agitation. But they also talked to him. They listened to him. That was a part of their remedy. And it turned out he also had cancer and couldn't get to a cancer treatment appointment. So they drove him to the appointment. Well, these are things that maybe we don't, when we see someone just in crisis on the streets, we don't necessarily intuit, right? But to have a model that really privileges listening and really privileges showing up for people and gaining their trust allows the first responders to do just that. And just a final remark along those lines is realizing that Tremaine had this background was really important. We at Street Roots know Tremaine because through the chat program, he actually has shown up in our space because we have frequent 911 callers whose crisis is homelessness. And Tremaine establishes relationships and really would look at their crisis as being homelessness and approach it in that way.
So CAHOOTS was an inspiration for this, but Kaya, I know that before landing on what the model would look like in Portland, you worked with Portland State University to do some research and specifically interview people who are unsheltered in the community to hear from them what they would like, what their experience has been. Can you talk a little bit about that process and what we learned from that research?
Sure, and I should say several years back, City Club did a report on health and homelessness that I found really inspiring in terms of really grappling with this, with going out and interviewing people about what their actual needs are. So one of the things at Street Roots that we felt like we could offer the process was to figure out ways to get ideas from unhoused people who would be affected by such a program into the policy making. And that, that takes effort, right? That takes going out to where people are and not expecting them to drop into City Hall. So we did 2 days of trainings with Portland State where we worked with Portland State students and then Street Roots vendors who had experienced homelessness. And we created teams to go out and do research, to do surveys on what it is that people would want from a first responder system when they're having crises. And in 2 days, the interviewers were able to do 183 interviews, so it was quite a result. And we ended up with 8 findings, so I'll say them to you, and I think that they're fairly remarkable and that they're unremarkable, and that we would they all got incorporated into the planning, right? Portland Street response needs to be separate from the police, right? So in order to trust the responder, the person needs to know that they won't do a warrant check and they won't actually pull them further into the system when their need is something different than that. The people who were interviewed said that Portland Street Response needs to prioritize training in mental health, de-escalation, trauma, and listening. Again, very important. Portland Street Response members should not be armed or run warrant checks. Uniforms should be recognizable and distinct from other first responders. Right? They need to be able to see that the first responders are Portland Street Response. And also to have the responders not show up with sirens that can, trigger seizures and all kinds of things for people. The referrals and transportation services would help the teams be effective, just like that example I gave with CAHOOTS in Eugene, right? Is often when there's broken pieces, how do we stitch it together? Often it's just giving someone a ride from one place to the next. Connect Portland Street Response with places where people can go. This is, of course, outside the purview of Portland Street Response itself, but it's a kind of mandate for us. Educate community members about emergency calls. So people out there living on the trails and in camps were saying, people are calling 911 too much for things that aren't criminal. And treat people with compassion and dignity.
Okay, for our radio audience, this is City Club of Portland's Friday Forum, coming to you from the Eco Trust building in Northwest Portland. I am Mark Jolin. With us today are Tremaine Clayton from the Portland Fire Bureau, the head of the Street Response team, and Kaya Sands, the executive director of Street Roots News. Today we are discussing Portland Street Response pilot program as part of the City Club's Houselessness series. So Tremaine, now I'd like to take a few minutes and have you maybe walk through a little more of the details of what this program is actually going to look like on the ground. Who are we proposing to send out? What kind of calls are they going on? What do you expect them to do when they meet with folks out on the street? And maybe talk a little bit about how this differs from the current first response system.
Yes. Again, the concept behind the street response is low acuity calls. That is, people call for service, 911, what's your emergency, police, fire, or medical. If there's no active crime, there's no active fire, there's no immediate life threat, what is the alternate response? That's what this program is looking to do. We are still working with BOEC, our 911 dispatch office, to develop the criteria that will be a little more specific onto what will get the Portland Street Response teams to the specific calls. That's a process. Currently, we do have police, fire, and AMR as our medical transport company. We have our set protocols. We all operate under the same medical director, Dr. John Ju here in Multnomah County, And so how do we take that system and make a big overhaul? It's going to take some time, but we are already looking at data to see what calls are there and what is coming up to our top priority in terms of prioritizing low acuity. This isn't something that if we just don't respond, the call goes away. We need to address the call. And so some of the scenarios might be that person down. Are they just asleep? Are they hypothermic? Are they having cardiac arrest? If you don't know 911, what's your emergency, that oftentimes will get a fire suppression vehicle like a truck or a ladder truck or a fire engine, gets AMR there, and when you have all those resources show up just to find someone was sleeping, that taxes the system, right? If we were able to have compassion and find a safe way, and I recognize that this is part of the conversation. Some people don't feel safe to approach that person. But if you were to feel safe enough to approach somebody to determine if they need assistance, maybe that fire truck and AMR would be the appropriate response if you're shaking and shouting and they're not moving. I'll teach you CPR classes later. So really it is, when we're talking about getting the right resource to the right person, that's really what this is. I mean, again, it's response reliability. As we're seeing the trends in those calls, because behavioral health is a prominent call, that's why it would be appropriate to have a mobile crisis responder. We do have that service here with Project Respond, and again, that's where we're trying to say, we're not trying to take over stuff and reinvent the wheel. We're trying to say, how do we fit our response model to the systems that are already in place? So with Project Respond being overwhelmed with the higher mental health acuity type calls, there's subacute, lower acuity mental health calls that are not being addressed. And that's that gap that we're trying to help bridge, not fix. This isn't gonna solve homelessness at all. This isn't gonna solve our mental health problems at all. This is going to help bridge some of those gaps so that we can create that sense of hope for just the one person. I mean, it's the one person having the crisis today. Let's respond to that one person today. When you look at the big picture of it, it doesn't make sense with the response model that we have. So we have to look at the response model, and that's really the big difference that this is. It's not emergency response, it's everyday response. How do we take care of the routine problems that just keep getting pushed to the margins?
And can I just jump in?
Absolutely.
Tremaine mentioned Project Respond, and some of you might be familiar with that and some might not. But when we were at Street Roots, when we were breaking down sort of this what do we have right now? Project Respond is the county, it's run by Cascadia, but the county mental health response to mental health crises that are at that higher level. And when we looked at how Project Respond is showing up, and we also knew from firsthand experience at Street Roots, about 70% of those encounters with people were accompanied by police. So we knew that was not a system, right, that would meet these particular needs. And the other kinds of things that we had out there were Cheers, which actually is now
Closed down.
Closed down. And that was really for when folks were needing to detox from alcohol and not really a contemporary system. And then Portland Street Medicine is an all-volunteer system, not at the capacity, and that's about going out and meeting people for their medical needs and establishing relationships, but at a much smaller scale. So all of these are little pieces that we have of the puzzle, but we didn't have the right system for this, and so because of that, we're sending out the police.
So you may have said it, Tremaine, but this is a pilot. I think we're just talking initially about 2 people, right? One vehicle, 2 people. And the discussion has been about piloting this project in the Lentz neighborhood. Can you talk a little bit about how that decision was made?
Yes. Again, the new technologies that the Fire Bureau is trying to do as we're advancing is using technology to our advantage. when we were doing an analysis, and this is my opportunity to give Robin Burek from Portland Fire and Rescue, she's our data analyst and a huge help to me to help articulate the findings that I was finding when I was in the field. But the data is showing the increase in call volume specific to that neighborhood, seeing an increase by 20% over the last 5 years, whereas the city as a whole has only seen 11% in terms of our call response volume. And in that specific area, it's about 50%, half and half of high acuity versus low acuity. That also, given the input from the commissioner's office, recognizing the limited resources in that neighborhood, it made sense that we would start to look our attention to that area. By having that geographical area that we can track calls specific to that neighborhood, also given the fact that downtown was saturated with services, we didn't want to skew our data and overwhelm the one vehicle downtown with a large call volume and seem like we're not doing the job because the job would be too great for just one vehicle. By being in that neighborhood, it's a little more manageable, and I think we would be able to show the data that we're trying to prove in terms of this service by being specific to that neighborhood, and then we'd be able to more clearly see how we can roll it out throughout the city.
So, and again, this is a pilot, so I'm actually interested in hearing from both of you. What outcomes are you going to be paying closest attention to help us decide whether this goes from being a pilot to something that we scale, maybe citywide?
Yeah. Well, to start, again, as a response reliability tool for the fire department side, we're looking at making sure we're sending the right resource. Someone in crisis, especially crisis on the street level, doesn't need an aerial ladder and a 4-person fire suppression crew. I mean, that's us being honest with what services are we sending. And so that's how we're kind of looking at it. And then recognizing that our emergency medical response system currently, we will treat, stabilize, and our only transport option really is the emergency department, right? So if we're recognizing that needs aren't being met through the 911 system and through the emergency department, the first thing we're going to look at is, are we reducing the numbers of ED transports? The other big task that we're looking at is if police are being sent, and we're recognizing the reports about how 50% of those arrested are homeless. If we're trying not to criminalize homelessness, then again, having an alternate response model, if we can see the reduction of police contacts and the reduction of arrests, that's something else that we'll be tracking. Now, again, we're still in the process of deciphering out what all these calls will look like and the response models the response criteria, because there are going to be calls that warrant a police officer, and that's just part of the system, that's part of the process. But if we can reduce the number of arrests, that is definitely something we're going to be looking at initially.
Yeah, I would add, backing up when we were first thinking about this at Street Roots, one of the, I think, interviews that our reporter Emily Green, who worked on this, did that really struck all of us with Bob Kazi, who directs the Bureau of Emergency Communications, and his enthusiasm really struck us. We realized that he had this can-do attitude that we could change this entire system and that his dispatchers could step up to it. And then I went and shadowed the 911 operators, and I was struck, first of all, by how many calls were coming in about homelessness and how much of their job really was to try to deal with the fact people were calling for 911 for reasons that really weren't 911, and they were trying to figure out solutions that weren't really about, the right first responder. I mean, we're creating a mess for the 911 dispatchers. So I think it's very exciting to think about the fact that we're going to clean up their work. We're going to help them really do their job well and match first responders in a really thoughtful way. I would say a second piece has to do with the fact that we really, just don't want conditions to get worse for people. And I know that might not sound like the most uplifting outcome, but in truth, often that's what we're doing right now. When we're not de-escalating situations, sometimes things do get worse. And I don't mean to imply that any of the shootings of folks who were experiencing mental health crises would have been different, because likely the police would have still been sent out. But thinking about that larger picture of when things go horribly wrong, how can we keep trying to chip away so that they don't, right? That's a very, very important outcome. And then I will also say that one thing that's really exciting about the pilot is Portland State University's Homelessness Research and Action Collaborative, who we worked with for that survey that I mentioned last summer with people who are unhoused. They're now going to follow the pilot from the very beginning instead of being reactive, to go out and interview people just like we did last summer, to find out what their responses are in terms of how is this system working for them. So we're going to also, in addition to that kind of quantitative data, we can really try to pursue that qualitative data from the people whose lives are affected.
All right, and I'm going to ask you to keep talking for a minute, because I think you've identified some outcomes from this project, and I think all of us who do this work know that folks on the street are facing challenges well beyond just having the right first response system. So I'm interested in hearing, Kaya, what your thoughts are about the limits of this pilot and what additional resources would be needed to have it fully realize its potential for folks.
Yeah, thanks, Mark. I think about how, in some ways, what we're trying to do is incredibly big. We're overturning an entire system. Commissioner Hardesty talks about how we haven't changed our first responder system locally since the late 19th century, right? Like, this is big. At the same time, what we're doing is incredibly small, in the sense that we're drawing a circle around Portland Street Response, and that is a first responder system. And everything outside of that circle, in terms of services, in terms of places for people to go, that's outside of Portland Street Response. But for me, that's also clarifying, right? We can fix this piece, but we can also be aware that changing the first responder system does not get places for people to go. It doesn't get them the substance use disorder, services and the mental health services that should go with the housing that we're trying to get people into, right? It doesn't get them places. Honestly, even in terms of the commons in our city, that Multnomah County just showed that 34% of all people in our county now are not making enough money to get their basic needs met. 34%. So what that also shows us is that they're not people, like 34% of the people can't just go and hang out at a restaurant. When we privatize all of our spaces all around our city, right, it also means the fact that we need to have an entire region in which we have places where people can go, places where they can be safe, places where they can be healthy. So just to give us a couple quick specifics, the county is trying to start the Bouchong Mental Health building, and that'll be downtown, multi-level. So the bottom level should be around a kind of living room where people can go and just be, because there aren't that many places. There's the library. There aren't a whole lot of places for people who are poor to just be, and people who are feeling just unsteady. And then on up in that in that building, the services will get stronger and stronger, and there'll be housing with wraparound services. At least that's the hope. And then we need to step up in our region and really pay for services. Really make sure that we have the money to get mental health services and substance use disorder services connected to housing. So all of that is outside of Portland Street Response.
Okay, I appreciate that. So Tremaine, I have one more question for you. When this pilot came before City Council, the police and firefighters unions were both talking about potential legal action if the council proceeded forward. What were the objections that they were raising, and what discussions have happened, or how have those discussions gone?
Yeah, I have to adjust my seat for this one. No, my understanding, this is a difficult this is a difficult town to work in, I guess, if you're a police officer. And I recognize that because a lot of the conversations around this have tried painting, or not have tried, have painted police officers in a negative light. And I think that's just the unfortunate reality of being a police officer. As a citizen, resident of Portland, I'm very proud of the Police Bureau and what they provide in terms of my own safety. As a first responder, we work side by side with them, so that relationship is very important. We continue to beat their soccer team, so I know that they're frustrated with that. But really, that's the only trash talk that I'd have to say about the Police Bureau. And that's the thing, even with Chief Outlaw, as she's leaving, I only had a brief interaction with her a few times, but definitely the position that she took to create an environment of change and seeing that change, and congratulations to Chief Resch, whom I've also had the ability and honor to work with as a police officer, and then just in some other personal avenues, knowing her off duty. I'm recognizing the leadership in all of the different bureaus that are starting to come together and take this proactive stance together. So I'm hoping that the purpose of this program, which is, again, response reliability that will benefit both police and fire, hopefully the outcome is that police will be able to take care of more of the higher level crimes, and as well as keeping our fire crews available for those emergency responses, fire suppression, and other serious emergencies. And so I'm hoping that as we come together, that conversation is the one that goes forward, and I feel confident. I know our Local 43, the fire union, they're very supportive of the program, but given that this is a program that is in our bureau, that and my bad for, excuse me, for saying an emergency medical responder, that there are no medical responders within our organization. This is a technical term in terms of the level of medical service we provide. Early on, the question of why fire, when we very first came to the table 2 years ago, just trying to get funding for the CHAP program, illustrated the knowledge of when you think about the fire department, you just think about the burning buildings, and not too many people see about this patch, which is the medical side. And so we have paramedics and EMT basics. So when we started talking about an alternate responder, it was a concern of whose job are they taking? So this definitely, and when you look at our structure, to provide the level of public safety that we do currently, if we think that we're going to take away from our current structure to fund something new, we will fail. And so the fire union stance is that we have to make sure that we're not trying to get rid of the fire department to create this new program, that this is in addition to. And that's been the theme that I feel that City Hall has given me personally when I've been looking at this, because that has been a concern. Who's going to do it if not fire? And so I think that's kind of where we're at. The unions are supportive of the program for its potential, but the process of how it's been going on, there are some legit concerns that are being addressed right now.
All right. Well, thank you both very much. For our radio audience, this is City Club of Portland's Friday Forum, coming to you from the EcoTrust building in Northwest Portland. I am Mark Jolen. With us today are Tremaine Clayton, Portland Fire Bureau and head of the Street Response Team, and Kaya Sands, Executive Director of Street Roots News. Today we are discussing Portland's Street Response Pilot Program as part of the City Club's Houselessness series. Everyone watching or listening today is welcome to ask a question. If you've written a question on an index card, hold it high for City Club staff to collect. You may also submit questions via Twitter using the hashtag FridayForum. To those who would like to ask a question at the mic, please identify yourself and ask one question in 30 seconds or less. So with that, we will transition to our question and answer period.
Wynn Wakala, City Club member. I fight human trafficking, and I'm worried about, I know if a girl is out on the street within the first 72 hours, they're usually approached by someone who will try to pull them in and sell them. How are you going to work with these young girls?
So one of the things that we've done in this process was a sequential intercept mapping, and that's really taking a look at a lot of the, really that intercept model was looking at law enforcement, and it was important to us to kind of get that information in terms of what services are already being provided out there by the city, and really trying to figure out where Portland Street Response can fit in without duplicating services and just being a redundant, broken part of the wheel, or can we like really bridge these gaps? So really it's going to, as the program develops, it's really gonna be about working with those service providers that do that kind of work so that we can be trained to look out for those clues and cues, which is the beauty of this work and the fact that we have time to sit down and listen. Some of the training that I've already received with motivational interviewing kind of starts to get into those deeper conversations, so that if I were to discover, or the team is able to discover that might be the situation, that's where we would refer, versus the old system. If we even knew that, we would just send them to the emergency department, and hopefully their underlying concern, in that case trafficking, may or may not even be addressed. But if we can determine that out in the field real time and get the right resources to that person, that's theoretically how that looks.
I wanted to ask briefly about the work you're going to do in educating the general population. I'll give you a little example from my own life. I live off near downtown, but a very dark and curvy road. I was coming out of my house and there was a person passed out in the street. This was not a safe place for him to be, and I thought a car coming around the corner could easily kill that person. And my reaction was to freeze, because I didn't know at that point what I was supposed to do. I thought, oh, they've been telling me don't call 911 because he's not harming anybody, it's not a police thing, it's not a fire thing. Eventually I did call 911 because I thought it was a life safety issue. But it strikes me, are you guys doing any work, because you've mentioned so many different organizations now doing different things, so that we know what we should do and not just feel lost or inappropriate?
Yes, one of the parts of this is the public outreach and education, and part of that outreach has already been started with, what was your outreach group? The community outreach group, in our I guess a subsection of our stakeholders group. But as we're starting to develop this, one of the advantages that I have is working closely with our communications team. One of the big concerns currently is outdoor burning, right? So in the summertime, we're obviously worried about the wildland urban interface concerns, but then in the winter, you know, we're talking about the same fire, but now instead of it being just cooking, it's cooking and warming. We have a burning policy, but it doesn't necessarily, it applies to the housed population. So what we're doing currently is working on our policies and saying, how do our policies match the issues that are in our city right now? And when we start to come up with that, then we can actually market that information and put it out via social media and forums like this. But in general, I think that's all we can do right now is say, trust your gut. Like if this was me, if this was someone in my family, and I come across them and there is a threat to life because they're passed out in the street, that would be an appropriate call. No one's gonna come and yell at you for calling 911, unless you do it like 17 times for the same person, right? But no, I think that's what this really comes down to, are those individual calls. Like what is the purpose of your call, really? And part of the bigger project is looking at those criteria at dispatch so they can get the information from you, work with you on the phone to figure out what is the appropriate response. And it's really the information you provide them that will give them the best picture to determine what response goes out. So.
And I'll add, right now, this will be the pilot phase, and that's all that we have budgeted. And the pilot phase allows time to figure out how to do this well. But ultimately, it shouldn't be on you to memorize all the different options you have. This should be big enough that folks in our city understand what's going on. In other words, we need to make sure that we all get behind this new first responder system, that we fully budget once we figure out how to do it, that we fully budget so that when you call 911 and you describe it, then Portland Street Response is sent out and you don't even have to worry about that. I mean, ultimately, I think a second number would also be fantastic, but this is all down the road. But right now, what would happen is if there isn't enough capacity, because it's one pilot in Lentz, the police will still be sent out, right? That's where we're at right now. We haven't changed that. So we need to get it right and then budget it so that when it's a Portland Street Response call and Bureau of Emergency Communications knows how to code that, then Portland Street Response is at capacity to be sent out. So that's going to be incumbent, honestly, on all of you and all of us in the city to push, because that's going to come down to making sure City Council prioritizes making this a full system.
Thank you. Anthony Petrel, City Club member, also work for Reach Community Development, one of the affordable housing partners in the community. My question is, once the triage and the initial crisis is dealt with, what's the next step? So what are the responders trained and able to do to provide and connections to resources in the community for folks that they're responding to?
Yes, this would be an expansion of our current chat program, in which when we have a person identified in terms of being a high utilizer of the system, when we make our contact with that individual to determine what the underlying cause is, we basically refer them to the specific resource that they need. So if they're having issues with diabetes, we're going to send them to that specialist, and versus them just going to the emergency department. Likewise, with this program, when we make contact with someone, we determine what the underlying cause is, and then we figure out the appropriate response. Sometimes it might be the emergency department, might be Unity, might just be that we can treat them right there, give them what their needs are, and send them on their way in a healthy and respectful way. And so it really is just going to become client specific to what that need is to determine what resource that we would connect them with.
And this won't replace the outreach workers who are already going out in non-crisis situations, the navigation teams that are going out and establishing relationships with people in camps to connect them with services. In fact, that needs to just have more money.
So I'm going to take a written question here. Have you identified who the behavioral health provider will be, or will the clinician be a member of the Bureau?
We have not set out an RFI, I get them confused. We have not put out the announcement yet for what that position is going to be. We're still having conversation to ensure that we have the right provider to be a partner. It will not be someone internally from the Fire Bureau. The medic, myself, will be the initial responder for the medical side of the vehicle. The crisis side has not yet been determined.
Good afternoon, Marissa Cade. I'm a City Club member. I wanted to, well, first of all, I was heartened by the story regarding taking someone to a medical appointment. And I was just wondering if you'll be capturing the data to determine what resources, especially resources to deliver people to, are missing from the system. And then also, do you anticipate a need, in addition to expanding living room type scenarios, to the need to expand access to shelters in the city?
I looked at kind of because of the Portland State surveys, the great part about this is how quickly and early the data research team from Portland State is on board with this program, because as we develop our protocols, the measures will be written into that based off of the data that they're helping us collect. And so yes, we will be collecting a lot of data throughout this program, because there are so many other overlaps to some of the programs we can be providing. As to the living room type situations with shelters, I'll look at Mark, but that's definitely not something that I would be addressing from the Portland Street Response model, other than being a partner with the joint office.
I think this goes to Kaya's earlier comment, which is that to make the street engagement, whether it's through the Portland Street Response or through all of the current outreach programs that we have, truly effective, we have to have resources on the back end for people to navigate to. And a shelter is part of that, but ultimately housing is the solution for folks. And they're not going to go to shelter and just stay there. We have to have a housing option for them. So I think we will find through this process what we know to be true, which is that in this community right now, we especially don't have enough deeply affordable housing with the kinds of support services connected to that housing that people who are struggling with behavioral health issues and physical disabilities need, supportive housing. I'm sure we continue to have more demand for shelter than we have capacity in the system right now. So it isn't just a shelter question. It will be, what are the long-term support services and housing resources available to the population who we're seeing outside? So I'm going to take one more written question, and then I'll come to back to the microphone. Have we looked at the Y Foundation in Finland? Long-term housing is the first priority, and then folks can get jobs, care, social services of various kinds. I'm not familiar with it.
No.
Okay.
Take note.
I was just curious, what's the duration for the pilot project, and then what's the budget for it?
So the budget for it has been $500,000, and the duration, given that at the start time, we're going to be going over the 2 fiscal years. So between now and July will be kind of phase 1. July to next January would be phase 2, and that would be the end of the budgeted items on it. And I think we're going to be doing at least quarterly, if not monthly, check-ins just to see how this process is going and forming that process, so that we can definitely look at the next iteration afterwards.
Okay, thank you.
Yeah, and actually, since I'm pushing from the outside always, I do want to point out then that we're going to have to come up with a much bigger budget to run the whole program, and people have to stay engaged in that process. We have a website, portlandstreetresponse.org, that we launched at Street Roots after we put the plan out, because there was such a widespread response, which we in many ways expected, because we hear people all over the city in neighborhood associations and the public safety committees, et cetera, who just want good options, right? If you have bad options, you're going to have bad results. So we need to have good options for folks. So the support of this has been really, really big. And so that website will remain, and we'll keep adding updates and ways that people can get engaged that we can see. It's also a place you can continue to endorse the plan. I was really grateful Commissioner Nick Fish actually endorsed the plan before the vote, and all the commissioners, and the mayor were very supportive of Portland Street Response. So it's a long haul for us, and it means that we all have to care that this happens, and not expect results that aren't connected to a first response system, and fight for the changes in those areas too, so that we can just keep making this area, hopefully, a model against the kinds of cruel impulses that might be happening on a federal level.
Hi, I'm Mengus Maps. I want to thank the City Club and the panel today for telling us about this important project. I have a service coordination question, I think. I'm trying to get my head around how this is going to work on the ground. I'm thinking specifically of Lance. I can get how you guys can go out, maybe stabilize someone who's in a medical crisis or a mental health crisis, and then try to connect them with services, and that connection with services seems quite powerful to me. But are those services there? And also, if they are there, is there a mechanism to coordinate? I can imagine, you show up, take someone in a car to a shelter, but I've tried to do that before, but there's often no room in a shelter. If you ever deal with mental health issues, one of the things I hear over and over and over again is that there are not enough slots. So is there a partner there for you to make this work? And if so, how does that work?
Well, I'm starting again. I'm not going to put Mark on the spot in all the way. But I will say that part of the coordination through the joint office is really already putting the foundation there. So the service providers that are operating, both the public funded, nonprofits, all of those folks that are touching these people and having contact, that's really what we have to develop. And that when I say trying to find our place in terms of the Fire Bureau, we've been making the same contacts with people as well, but the way we operate in that siloed emergency operations standpoint, when I'm responding on truck 8 and I have this client, I don't know what's going on in the service coordination arena with those service providers. That's why this position that has been developed is not a part of emergency operations. It's in a different division. Started off in our medical services. Now I work in the chief's office, trying to figure out what is that role and figuring out who all those people are. And I've been tasked with and have been privileged to have the opportunity to be that person to figure out how that fits. And that's really the personal thanks and gratitude I have for my leadership that's trusted me. But that's what the work is right now, is figuring out where the Fire Bureau fits. The model says that it works, but now we have to make that model integrate to the larger system. And that's really what the next couple of months are going to be doing, and then time will tell when we roll out in April.
So Disability Rights Oregon issued a report that some of you might have read in June that 73% of all the arrests in emergency departments 2017, or in 6 area hospitals 2017, 2018 were unhoused people, 73%. So these are folks that didn't want to go back outside for the most part. And so what happened then is they went to jail. So this is not, I'm not really answering this except to just say some of what we've got to start with is just to have the results be less bad.
So I think we have time for 2 questions, maybe one. Take from the microphone and see how we do.
I'm Sandra Decker, and I wanted to mention to Tremaine, you probably are aware of the NET program, Neighborhood Emergency Team, and I'm active in the Hazelwood neighborhood, Mill Park, and am aware that we have quite a number of highly trained people who could be on call for the Lentz neighborhood, including knowing how to move people who are lying in the middle of the street. And I don't know how we'd get those kinds of calls except through Jeremy Van Huren, PBEM, and we do get deployed for all kinds of things. So maybe work on calling us. And we have a meeting at Sunnyside Adventist Church. Our monthly meeting is next Thursday, potluck 6:30. Come on over.
You got my interest?
Yes.
Yeah, I will be at dinner. No, I definitely appreciate the question, because that is that future focus question. We do have a lot of resources already, and it is a matter of how do we deploy those resources. When this pilot kind of shifted just from like a high utilizer, how do we fix the current system, to more of a crisis response, the thought of tasking volunteers to go into that circumstance didn't seem very sustainable, just for the personal sacrifice that it takes to operate in those types of conditions. And having benefited from NET teams in terms of professional work and getting to be a part of the training with the NET teams, I definitely see the potential for a workforce there. But again, tasking, this is definitely an all hands on deck type of a project, and I think we can get there. But as we're starting out the pilot, it just didn't seem viable to have volunteers going into that response.
Okay. I have a copy of Complaint-Oriented Policing, Regulating Homelessness in Public Square, a study that I emailed to Mark Jolin last year, and I'm going to give this to you.
Thank you. So I'm going to quickly ask this last question and ask you to be brief, but it seems very appropriate. It says, how can City Club members support the street response program, specifically Street Roots in general?
Oh, street roots in general?
Well, it sounds like both.
Buy the newspaper from Street Roots vendors. Just every week, people in Portland put $10,000 into the pockets of unhoused and poor people by buying the paper. So we want to triple that. In terms of Portland street response, I feel like I'm giving you a little bit of a roller coaster, because on one hand I'm saying we just want things to be less bad, but on the other hand I'm also saying we are about to do something really big. So that's the note I want to end on. We are about in this city to change our first responder system to become more humane and compassionate and constructive. It's going to take all of us to do that, but I want us to feel that, right? This is going to be a signature moment in the history of Portland, you know, so step up. Make sure you put that pressure on elected officials. Make sure they know that you want this, because that's how things get done.
That was a perfect end name. So thank you all so much. Like Kaya said, we really do encourage you to continue the conversation. You can do it online. Follow City Club, PDX, City Club on Instagram, Twitter, and Facebook. And just one more time, the appreciation for Mark Jolin, Tremaine Clayton, and Kaya Sands. Thank you.